Adrenal fatigue is the cause of many symptoms and involved in many illnesses. So in this video, I want to explain what adrenal fatigue is, what causes it, and how you can recover from it quickly. At the end, we will also discuss the controversial question of whether adrenal fatigue is even a real diagnosable condition. Okay, so to start off, what exactly is adrenal fatigue? When we talk about adrenal fatigue, we usually mean a chronic underactivity of the adrenal glands. Sometimes the adrenals slow gradually over years and months, but what oftentimes happens is that you feel like it happens very quickly and you feel like you've hit a brick wall, where you one day are completely knocked out and all the rest in the world doesn't help you get back up. This is called adrenal burnout, and it is very similar to chronic fatigue syndrome. They're actually both kind of intertwined. Now, when this happens, so when your adrenals are completely exhausted, most of the metabolic functions in your body break down. So you don't just need rest, but also nutritional support for the adrenals and the body to become healthy again. Why? Because the adrenals are involved in so many processes in your body. Let me quickly explain what the adrenals are so you understand their importance. Basically, they're walnut-sized, rounded, disc-shaped glands atop of each kidney, so they're located on your lower back. They're important because they secrete specific hormones that help you deal with stress. For example, adrenaline, noradrenaline, cortisol, aldosterone, and also small amounts of the sex hormones, for example, estrogen and testosterone. When someone talks about stress, the adrenals, and the involved hormones, they usually refer to either cortisol or adrenaline, because those are the main players involved in your fight or flight response. They're meant to help you act quick and either avoid danger or fight the danger. In terms of body functions, this means an increase in blood sugar levels, a rise in blood pressure, and increased energy production to help you act quickly. Now let me quickly use the example of cortisol in all of this because it helps us explain how adrenal fatigue develops and how it gets worse over time. Basically, under acute stress, your cortisol levels will rise. This is a response of the adrenal glands to the acute stressor. But during constant stress, when the adrenals always have to work overtime and release more and more cortisol, they will eventually burn out. When this happens, it leads to low cortisol because the adrenals no longer have the power and nutrients needed to produce more cortisol. And all the factors involved in the hormone production have basically been used up. Now, the primary symptoms of all this will be high irritability, feeling tired but wired, and chronic fatigue that doesn't go away with rest. The main problem here is that many people will then rely on stimulants to get them going. For example, to get up in the morning or to help them with exercise. This is a very common mistake. It will help you in the short run, but in the long run, it will just deplete your adrenals even more and make the problem even worse. Now, down the line, you will probably also develop some secondary symptoms, and these can include hormonal problems and low libido. That's because all the progesterone was used up. This is something called the cortisol steal that I might explain in a different video. You will have poor digestion because your body will be in this constant state of fight or flight where digestion is not prioritized. You will probably also have sugar cravings because your blood sugar regulation is completely messed up. And many people also have cold hands and feet because their energy system kind of breaks down. Of course, there are also many other symptoms that you could develop. Basically, what you have to understand is that when your energy system is out of balance, anything related to your metabolism and energy system will be affected. Okay, with all that said, what are the main causes of adrenal fatigue? How can you avoid it? The number one cause is always stress. And by stress, I don't just mean physical stress, so actively overworking yourself, but there are also other stressors. They could be nutrient deficiencies, they could be emotional stressors such as trauma, and they could also be environmental stressors such as toxins. The reason stress is so important in all of this is because it triggers the sympathetic nervous system, which activates your fight or flight reflex. This is what I talked about earlier. When you're constantly in the fight or flight reflex, your body has no time to wind down, to relax, and to recover. You also often hear the term sympathetic dominance, which is somewhat related to adrenal fatigue, because if you're constantly in the sympathetic nervous system mode, your adrenals over time will run out of energy and will run out of nutrients, so they will break down. Okay, at this point, you're probably wondering, how do you detect adrenal fatigue? How do you correctly diagnose this problem? Well, the first thing I need to say is that from a medical standpoint, adrenal fatigue is not an accepted condition. Only when the adrenal function is so low that it is detectable in the blood will you hear a doctor speak of Addison's disease. The problem is that many people without detectable Addison's have symptoms related to adrenal fatigue. So what do? What if you went to your doctor, asked them to check for Addison's disease, and your blood work came back and it's completely normal? Well, there are certain things you can do. The first is you could measure stress hormones such as cortisol and adrenaline in your blood, urine, or saliva. The problem is that the levels fluctuate constantly, so from moment to moment and throughout the day. So even then, most of the results come back fine. That's why my personal preference for checking for adrenal fatigue is actually a hair mineral analysis. Why? Because in the hair, there are some definite signs that someone is suffering from acute stress or even from adrenal burnout. Clear signs of acute stress will be a high sodium level, which is very stimulatory. That's why the body will drive sodium in acute stress situations, and a high potassium level, which usually goes up to balance the sodium. Other things our body will do under acute stress is to get rid of magnesium and zinc, which are both calming minerals. So if you see high sodium and potassium and low magnesium, for example, that's a clear sign someone is suffering from acute stress and high adrenal function. Now, if you wanted to spot adrenal fatigue or adrenal burnout, you would actually look for low sodium and potassium values. Why? Well, as the adrenals work overtime, they lose their ability to drive up sodium and potassium. So very low levels of sodium and potassium on a hair mineral analysis are a clear sign of adrenal burnout. This is what this looks like. Getting a hair analysis also helps us understand how to get out of adrenal fatigue. Now, this is a topic for a different video because it can become quite complex, but the cliff notes are, well, that you need to refill the lost nutrients. This includes strengthening your adrenals through specific nutrients and also giving you back those calming minerals such as magnesium and zinc, and sometimes also calcium. And you also need to reduce your stress load. So this can include rest, relaxation techniques, and sometimes also therapy. To wrap up this video, let me tell you this. Detecting and dealing with adrenal fatigue can be a long process, and it can be overwhelming at times. I know this from personal experience. But there are people out there who can guide you along the process and can help you out in times of difficulty. Take it one step at a time and don't be discouraged by setbacks. You will see progress if you stick to the proven methods of dealing with adrenal fatigue and if you stay positive.